Welcome to www.unitedmedical.sg. United Medical specializes in a complete women's healthcare service. Understanding and compassion, matched with highly developed skills and knowledge, makes us a truly distinguished practice. Understanding pregnancy. While each pregnancy is exciting, it is also unpredictable, and every woman wants the best outcome when it comes managing it. At United Medical, we aim to provide and share information that guides you through your pregnancy journey, leaving you more prepared to enjoy your pregnancy to the utmost. Our philosophy of care. At United Medical in Singapore, we will be with you at every exciting step of your momentous journey to parenthood. From the moment you start down the road to bringing new life into the world, we provide only the best care while doing our utmost to minimize stress for you and your loved ones. We will work with you to provide antenatal care and delivery and postnatal care performed by our experienced and passionate Dr. Stephen Teo and Dr. Liana Ko. We believe that we are all in this together and will guide and support you through every step of your journey to parenthood. First trimester. One of the most common concerns of parents-to-be is whether the unborn child is going to be affected by chromosomal or birth defects. Birth defects occur in around 3% of babies, and chromosomal defects are present in 0.5% of pregnancies. The chance of a pregnancy carrying such a defect can be assessed as early as the first trimester, in the form of the first trimester screening, otherwise known as one-stop clinic for assessment of risk, OSCAR test. This is a non-invasive assessment, comprising of a blood test for the mother and a scan of the fetus. The resulting risk score will allow the parents-to-be and the obstetrician to plan ahead for the outcome of the pregnancy. All expectant mothers are encouraged to have the test done, regardless of age. Early pregnancy symptoms. Early pregnancy symptoms help you detect pregnancy a few days after conception. Many of these symptoms are subtle and can be confused for other problems. However, if you have more than one of the early pregnancy symptoms, then most probably you have conceived. These signs help you understand your changing body and the growth of the baby inside you. Here are some early pregnancy symptoms. Missed period. Though a very prominent early pregnancy symptom, a missed period can have many causes. By the time you have confirmed the period was delayed by pregnancy, you are already a few weeks into it. Nausea. Morning sickness can take you by surprise any time of the day. You feel queasy all of a sudden. Many women are unable to eat spicy or greasy food because of this symptom. One of the ways to deal with this is to eat light, eat smaller meals, and keep your surroundings cool. Sensitive breasts. Tender breasts are another problem for pregnant women. Apart from tenderness, you may also notice swelling of the breasts. Veins along the sides of the chest become more prominent. The color of the areola darkens. Spotting is known as implantation bleeding in medical terms. Implantation bleeding happens a few days after conception, when the embryo implants itself on the uterus wall. This is where it will stay and develop in the next 9 months. Cramps. Along with implantation bleeding, you might also experience cramps. Cramping is another early pregnancy symptom that alerts you to conception. It is like the cramps you feel during your period. If the cramps are severe, consult your doctor immediately. Tiredness. You may feel tired all the time. Fatigue is one of the more subtle early pregnancy symptoms. Be careful of ignoring the signals your body is sending you to take it easy. Cut down on your workload and take plenty of rest. If you have one or more of the early pregnancy symptoms, you should consult our obstetricians. Early pregnancy screening. The first trimester screen is a new, optional non-invasive evaluation that combines a maternal blood screening test with an ultrasound evaluation of the fetus to identify risk for specific chromosomal abnormalities, including Down syndrome trisomy 21 and trisomy 18. In addition to screening for these abnormalities, a portion of the test known as the nuchal translucency can assist in identifying other significant fetal abnormalities, such as cardiac disorders. The screening test does not detect neural tube defects. Pregnancy dating scan. All pregnant women are offered an ultrasound scan at around 8 to 14 weeks of pregnancy. This is called the dating scan. It's used to see how far along in your pregnancy you are and check your baby's development. Our obstetricians will book you a dating scan appointment. It will usually take place at our specialist clinic. You may need to have a full bladder for the scan, as this makes the ultrasound image clearer. You can ask our staff before the scan if this is the case. The dating scan usually takes about 20 minutes. What is the purpose of the dating scan? The purpose of the dating scan is to check how many weeks pregnant you are and work out your due date, the estimated date of delivery, or EDD, whether you're expecting more than one baby, that the baby is growing in the right place, your baby's development. Some abnormalities may also be detected at the scan, such as neural tube defects. Spina bifida is a type of neural tube defect. Contemporary Down syndrome screening. The vast majority of babies are normal. However, all expectant mothers have a small risk, about 2%, of delivering a baby with a major physical and/or mental handicap. This may be due to a chromosomal abnormality, genetic disease, or structural abnormality in the baby. The commonest chromosomal abnormality is Down syndrome. Down syndrome occurs in 1 out of every 700 babies born. It causes learning difficulties and, in many instances, multiple medical problems. All pregnancies, regardless of a woman's age, are at risk for Down syndrome. Some couples may choose to be tested for Down syndrome, as such information may help them prepare psychologically for the birth of a handicapped child or reach a decision about whether or not to continue with the pregnancy. Other couples may choose not to be tested for Down syndrome, especially if they have decided to keep their pregnancy regardless. Although invasive diagnostic testing through chorionic villus sampling amniocentesis is the only way to know if the fetus has a chromosomal abnormality, such procedures are associated with a risk of miscarriage 0.3%. Screening tests are instead available to better estimate the risk of Down syndrome in each pregnancy. The result of the screening test may help couples to decide if they want to pursue invasive testing. Why is folate important? Folate is a B vitamin crucial in the development of baby's nervous system. It has been shown to reduce the chance of having a baby with a neural tube defect, a disability affecting the nervous system. Folate is easily destroyed during cooking, and large servings are necessary for adequate intake. The simplest way is to take a folate supplement, 15 mg tablet daily for the first 12 weeks of pregnancy. Folate is particularly important if you suffered from epilepsy, thalassemia, or have a family history of having relatives with a neural tube defect. Second trimester. As the pregnancy advances, a detailed ultrasound scan can be performed in the second trimester to check for structural defects within the baby, as well as markers of chromosomal problems. This is commonly performed between 18 to 20 weeks gestation, to allow time for decision-making and intervention. However, the limitations of such scans have to be accepted, as minor defects may still be missed, despite the best of operators. Third trimester. When the pregnancy reaches the third trimester, the focus shifts towards the baby's growth and planning for delivery. A scan of the growth parameters in the third trimester will allow us to check on babies that are growing too quickly or too slowly. This will allow parents to be and their obstetrician to plan for the delivery timing and route. Mothers who are at risk of gestational diabetes may also be offered the diabetes test in the third trimester. Delivery. Most pregnancies will conclude with a vaginal delivery, while others will have a cesarean section planned from the early antenatal period. This may be caused by specific conditions that make vaginal delivery inappropriate, such as low-lying placenta, breech presentation, etc. Others may attempt a vaginal delivery, but end up with a cesarean section when labor does not progress or is unsafe to allow further progress. In selected cases, assistance may be offered for vaginal delivery, in the form of forceps or vacuum, only when deemed appropriate by the obstetrician. Postnatal care. After delivery, the mother's body undergoes dramatic changes to return to pre-pregnancy state, and she has to deal with healing of delivery wounds, breastfeeding, care of the newborn, as well as the swinging hormone levels. The postnatal checkup will allow the obstetrician to assess the health status of the new mother and offer assistance to those in need. Routine gynecology screening and contraception options will also be discussed. Dr. Stephen Teo, obstetrician and gynecologist. Dr. Stephen Teo graduated from National University of Singapore and went on to train in obstetrics and gynaecology with the Royal College of Obstetrics and Gynaecology, United Kingdom. He attained the specialist degree of Master of Medicine ONG from Singapore and became a member of the Royal College of Obstetrics and Gynaecology, United Kingdom. Besides general obstetrics and gynecology practice, Dr. Teo's passion lies in fertility treatment and advanced keyhole laparoscopic surgery. As no two patients are the same, the combination of these subspecialties allows Dr. Stephen Teo to individualize therapy for each patient. Please visit our site www.unitedmedical.sg for more information on Singapore Obstetrics.